Hi, my name is Avery Maggiello, and today we're going to be talking about the proper use and donning of a surgical mask. But why do I need to wear a surgical mask, especially if I'm not in a high-risk population? Well, that's exactly why you should. A surgical mask does not protect the user in the way that you would think. In fact, it protects everyone around the wearer by capturing those respiratory particulates of the wearer. Even though you may feel well with no symptoms, it's possible that you could be an asymptomatic carrier of the virus. The face mask will reduce the risk of spreading infected droplets to your coworkers or your surroundings. This means that everyone who walks into the facility and refuses to don a mask puts everyone else in the facility at risk. For this reason, we will be asking everyone to wear a mask. If you choose not to wear a mask, you will be asked to leave, with very few exceptions. For those that choose to work that day, you'll be picking up a new single-use mask and following these steps for the proper use and donning each day. First, my hands are dirty. I don't want to touch my mask or my face. I'm going to be washing my hands for 20 seconds with soap and water, or the next best thing, hand sanitizer. Very few people realize that you should be using enough hand sanitizer to simulate soap and water hand washing procedure for a full recommended 20 seconds, at which point the sanitizer should begin to dry. This means getting in those hard to reach, potentially virus harboring areas, such as between your fingers and under your nails. Now, I will be picking up my mask by the ear loops, at no point touching the surface of the mask. I want to make sure that the blue side of the mask is facing outward and the pleats are facing down like shutters. I'm going to cover my nose and my mouth and loop around my ears as so. Let's make sure the mask is sealed against my jawline. There's virtually no room for respiratory particulates to escape from the bottom of my mask. Now there's a big gap at the top of my mask. It keeps sliding up. To avoid that, pinch the metal piece across the bridge of your nose, effectively sealing off the top, making sure it doesn't slip, and ultimately capturing any expelled droplets. I want to make sure that it's comfortable enough that I can keep my hands off my face for the remainder of the day, avoiding touching the surface if at all possible. This is my only mask for the day unless soiled, at which point I will need to immediately go get a replacement. Make sure that you wash your hands to protect yourself and others prior and after each removal and redonning. During lunch, I need to temporarily store the mask in a way that avoids cross-contamination. Please avoid putting the mask on the table, in your purse, etc. I'm opting for a paper bag as my storage, but you can store anywhere that does not provide the chance of exposure for others. At the end of lunch, I will put my mask back on, washing my hands, ensuring that I refit it properly. Please remember that this is temporary storage, not overnight. This is a one-use mask. At the end of the workday, when my shift is over, while I'm still at work, I will rewash my hands, take off my mask, and place it into that bag. You can dispose of your mask in common household trash if concealed in a lined container or bag. We do not want the cleaning crew inadvertently exposed, so be vigilant for site-specific procedures regarding disposal. Thank you for watching. Stay safe, and if you have any questions, please reach out to your local CRE. Thank you.